and gentlemen, welcome back to Performance Talk. My name is Yul Gordon. My partner is here today with me, Chris Costa. Chris, how you doing today, man?
I'm well, you. How are you doing?
I'm doing all right, man. I'm doing all right. Life is life, and things happen, but yeah, everything is fine. Why don't we let our guest introduce herself today and tell us what she's up to, uh, Aleena?
Sure. Well, my name is Aleena Canner. What I'm up to is that I just got off a flight and I'm in San Diego and it's beautiful.
Oh, you really
Um,
you really can't beat that right now. Not
nope,
the not weather wise.
you
So
can't.
so is this a business trip or otherwise?
A little bit of business, a little bit of enjoyment.
Okay.
That's how I travel.
Well, you got to kind of wrap them up sometime just to make it worth the trip.
Yes, I
You know
agree.
what I mean? So
Yes.
tell us a little bit about yourself. You're an athletic trainer, and
Yeah. Yeah, I'm an athletic trainer and I do postural restoration. I am certified through the Institute and postural restoration. I don't know how much your audience knows about it, so I can give a little bit of a background if
come on
needed,
with it.
and I can tell you how I got into it, etc.
Yeah.
So I just background on me is I was a gymnast growing up, and then I became an Olympic weightlifter when I went to grad school, and I was a very competitive athlete in my 20s, and I did athletic training at University of Arkansas. A New York girl in Arkansas, just
Yeah. That
living
that
life.
that was culture shock at first, wasn't it?
Yeah, it was definitely, but I loved it. So it was the best experience of my life. And I realized when I was there working with athletes that they just really weren't treated the way that they should be. I felt that their care was not as extensive as it could have been, even at this SEC college level. I think that we got wrapped up in like technology instead of really figuring out what was the root cause of what was going on with these athletes and why they were hurting, why they were you know, having these large scale injuries, ACL tears, Achilles, etc. So I ended up after school trying to do some continuing education and learn more. And I found out about postural restoration as I was also becoming an athlete myself. I mean, I was always an athlete, but I was getting really competitive. So I decided to take a little break from athletic training and focus on my career as an athlete. And during that time, I learned a lot about postural restoration. I started to train people, like personal train people. I moved back to New York and did that for a while. And then I got really into understanding PRI, which I'll explain. I ended up moving across the country to Texas to learn postural restoration as I have a mentor over there who has a very established clinic with vision and dentistry kind of enmeshed in what she's doing. She had a nice integrative practice. And so I went out there for a year and a half.
Wow,
I,
I'm sorry, but you don't really find vision and dental and
yeah,
postural restoration all together. That's not,
yes,
yeah.
yeah, yeah. So PRI is short for Postural Restoration, and the institute is founded by Ron Proska in Lincoln, Nebraska. And the big thing that we learn there and what we do is it's a very, very integrative approach. And so I went down to Texas to learn how to do that integration myself and bring it eventually. I mean, I didn't know what I was doing when I went down there. I just wanted to learn. And in the end, I decided to move a couple places, experience life a little bit. And now I'm more settled in New York, doing my business in New York, where I have a team of optometrists, a team of dentists, a very integrative network over there. I work with myofunctional therapists. I work with therapists, regular therapists that are psychotherapists that really help my patients. I work with high level functional medicine practitioners. There's a functional medicine MD I'm sending people to. There's nutritionists I'm working with, holistic thought process on looking at the body. And so, really, I work very closely with my optometrists and dentists. And it's been a blessing. It's been a lot of learning and I'm excited to see it grow more. But postural restoration really looks at the nervous system, and we look at the asymmetries of the body, and we're all inherently asymmetrical. So it is based off of that, and
So
I can
what?
explain more if needed.
So why is that important for athletes? Why is vision and dentistry and you know PRI, all important for athletes.
So the way your eyes experience life around it, your surroundings, is vision, not sight. Sight is being able to look far and see a board in a classroom. Not that I don't care about sight. I do care about sight, but I care about vision. So how your posture, the posture you're going to assume if you're standing on the edge of the Grand Canyon, is going to be different than if you're standing on a flat surface in your house. So that is an extreme postural change, but we have these minuscule changes that occur to us all the time. Things that we don't even think about. When we're sitting down versus standing up, our visual system reacts differently. So when we look at these things, especially in athletes, more than general people, like baseball players, think about how much they need their vision to work properly. You can change a quarter of a script on like a prescription on a baseball player and change their miles per hour of how fast they're playing, of how fast they can throw the ball. I've seen it happen. Because in Texas, I did get to work with a lot of athletes, and we saw some wild changes with both vision and dentistry. And then with dental, how your teeth touch each other is called occlusion. How those teeth touch has a lot to do with how your body also can respond to space and how it can organize internally, and be able to also understand its spatial awareness and environment. So people don't think about that because people just think teeth. They don't really think that how your bite matters. But if you have a bite where your teeth are not hitting in what we call sound occlusion, I could put money on it that you're going to have a hard time fully getting into stance on one side of your body and then swing on the other, and then vice versa. You might be stuck staying on only one side of your body. So let's rewind a bit. Let me get to the asymmetries because that'll kind of explain the dental and vision a little more. So we are all asymmetrical. The diaphragm on our right side is bigger than the diaphragm on our left side. It attaches lower into the lumbar spine. This is something we don't learn in traditional schooling. PTs don't learn it. Athletic trainers don't learn it. I don't know why. It would be great if we learned about this. We have 3 lobes of lung on the right side and only 2 on the left. We have a vagus nerve that is longer, I think, on the right side. I was just writing a presentation this morning. I could literally check. Let me tell you. I think there's more asymmetries I was learning about.
So while you're
Yeah,
looking at that
I
and
found it.
looking that up, you got it. Go ahead.
The vagus nerve is longer on the right than the left. The diaphragm is larger on the right than the left. Our liver is on the right side, and that's on average 3 pounds. And like I said, we have 3 lobes of lung on the right side. So we just have these internal asymmetry. And our brain hemispheres are also asymmetrical. And so we actually see that most people are righties. Most of us know that. There's not that many lefties. And there's a reason for that, and that is neuroanatomy makes us righties. People that are actually ambidextrous struggle with a lot of things, from what I've seen, because they haven't picked a side. They don't know where their dominance is, and so they're constantly in rivalry with both hemispheres of the brain. So really everything with postural restoration goes back to understanding, 1, the asymmetry, and 2, just the brain and what it is wanting. So when we talk teeth, the way the teeth touch gives the brain signals. And if the teeth are only touching on one side, I could put money on it that that person might be struggling. So with whatever, chronic pain, not hitting their absolute potential. So yeah, so that's how dental and vision kind of come into the picture. We don't jump to that when I'm like assessing somebody, but that does like change what I do because people are always very interested in that aspect.
Is there literature out there to support that shows?
Oh yeah,
Why is it not at the forefront? Why, when we're
it is with the
for
institute that I'm
asymmetry?
studying. I know. So all of these asymmetries and all these this information I'm talking about, the end of every single PRI course, there's like so much literature. There's not that many like studies that are saying, let's look at this vision and let's relate it to this bite. But there's a lot of literature showing a lot of the asymmetries. And that's pretty much what postural restoration does is find this literature, they talk about it, they teach it to us. All of our stuff is credited for physical therapy, occupational therapy, athletic trainers as continuing education credits. And it's all evidence-based medicine. So
Yeah, I
So
mean, a quick Google Scholar search, right, pulls up a bunch of stuff on asymmetry, and there's
yeah.
12 papers. The first from 1973, just talking specifically about the game, but there's really no physiological asymmetry context in here. Most of it's about the brain, cerebral system, the skull, patients in asymmetry, right? But like none of this is really focused on how asymmetry truly affects our physiology, our mechanics, and then
Oh, there's tons of articles.
Really, we're talking about. You really have to dig to find that stuff.
You have to dig. You have
It's
to
kind
dig
of a
for
shame.
them. I know. It is. You have to really like dig deep. There's some good ones. I'm in the middle of working on this presentation I worked on all morning that the optometrist I work with and I are doing next week for a group of optometrists. So I've been like scanning the research. It's hard to find, but you can find bits and pieces. There's literature, but there's no like big studies. And that's what I really would like to contribute to the field somehow in the future.
Well, somebody has to do it, because if there's a relationship, and we talk primarily about athletes and athletics on this podcast, and the profession, and that's where we're related to. But if in my mouthpiece as an athlete, basketball player, football, hockey, whatever, in my mouthpiece, you're telling me if I don't mold that correctly and I'm sitting crooked,
Well,
I could have
if
issues.
your normal bite is crooked and you're molding it to your crooked bite, then you're going to have issues.
No, because you understand that.
I understand it.
Right. Athletes
A lot of
don't
people
understand
don't.
that. Right. So
I mean, hockey is interesting because they do all wear the mouth guards. And mouth guards also do help with the concussion management just a bit in case they have a head injury. It actually does mitigate the symptoms slightly. But just because they wear a mouth guard doesn't mean that that's a proper made guard.
Properly made or properly fitted?
Both. Because
yeah.
the guards that we use when I work with, I have a professional golfer right now. We're going to get him a guard made eventually. And that guard is going to be very custom fit to him and purposefully because everyone's bite is unique. So just using that piece of plastic that they use is kind of like an eraser. So they're erasing their normal occlusion, but it's not necessarily giving them a better one in hockey, let's just say. But I don't think it's bad for them to be using that. I think it's probably way better. Football players use it too, I think.
Yeah.
Sometimes.
Yeah, that's one of those subject matters that needs a shovel. In other words, it needs some more digging.
I agree. So they actually just like 2 years ago banned not custom appliances for professional golf, but appliances that are like that, the ones that you mold for professional golf, because they noticed that golfers were actually hitting the ball with more power. And I know physiologically why that's happening, but Golf Association doesn't know why. They just realized that people were wearing these appliances and they're hitting the ball with more accuracy. And I think more powerful was the main thing that they noticed. And so what they did is that they only allowed it if you have a custom appliance that you put in and you cannot take it out for when you're playing the entire time. So what's interesting is those custom appliances are, if it's made the way that I've learned to make it with the dentist I work with,
right,
is actually going to benefit the golfer more by far than a plastic appliance. So I don't think they know what they're doing over there, but they saw that. I wish they took measurements of the speed before and after a mouth guard, because that's like an easy study right there.
Well,
CrossFit athletes have also started wearing them.
Basically, what they have is anecdotal evidence, not scientific evidence, because they didn't do anything that made their decision a scientific one. Yeah. Although I've seen anecdotal evidence prove out some things.
See it all the time.
Yeah, it does all the time, especially with your other professional group you're working with, Vision.
Yeah, so I work with SUNY Optometry. It's a well-known optometric school in Manhattan. I work pretty closely with one of their chiefs there, and one of their vision rehab floor. A couple of their doctors on that floor, optometrists, and they're all behavioral, like neuro optometrists. They're not regular optometrists, so they've done more schooling after the regular optometry schooling to get that.
Right.
And it's really been eye-opening for me to learn a lot from them and see on myself and then also on my patients how much vision can make such a significant difference.
I'm going to give you one point that I learned a long time ago about vision as an athlete. Proper posture and your head and eyes at 45 degrees, and you will see much more of the playing field as opposed to either looking up or looking down.
Okay, but if your center of mass is slightly off because you were born with maybe a situation, then you're not going to be able to do that effectively.
Why?
So what I do is, because you could be born with your eyes that don't know how to work well together. Not everybody can do that properly. Some people need a prism to get there.
One eye is usually worse than the other too in terms of sight.
Yeah.
For sure.
We're gonna set off your equilibrium too.
For sure. Well, there's an asymmetry there in general that we're used to as our natural equilibrium. That's our natural equilibrium, right?
Okay.
But like you were saying, you're right. If you're looking straight, horizontal plane, like field of vision, that's how we should be looking. But I see people every day in the clinic that I say, take a walk for me, and I watch their gait. They're looking directly down.
Right.
Not because they want to, not because they were told to, because their eyes do not trust their surroundings. So then sometimes, I do techniques on them, and I can explain how PRI works first. We do that first, always. And then if they have an actual visual discrepancy and vision complaints, then I send them to my optometrist. And one thing people will notice is that they don't look down as much, which is interesting. So now if we're thinking in an athletic perspective, someone's on the field and they have this feeling of wanting to get their eyes looking down because they don't trust their surroundings for whatever reason, you can give them some sort of a lens to open space a little bit, not for sight, for vision, to give them better periphery or whatnot. I don't know. I'm not an optometrist. That can be game changer for somebody. Literally game changer.
How? How?
I would think too, like if you clench your jaw a lot, right? You create a lot of tension, right? You're creating asymmetrical tension too. You would think that would eventually lead to inflammation, whether it's mandibular inflammation, but then, hey, does that inflammation radiate to some of the nerves that it might affect? Not only facial nerves, but also maybe even the optic nerve that affect how much tension is built in the face and where you're actually looking and how you use your optics effectively. That then a periphery, which affects whether you're able to see what you're working with or you're not working with. I guess there's so many that could. I'm not saying it does tie in because I don't know what the research is, but anytime you have an area with localized inflammation, it's going to affect surrounding areas, and there's so many nerves just in the face and the head alone, so imperative to our equilibrium, right, and our fine motor skills. That anything that's affecting the skull is likely to have a pretty profound effect on the rest of the body. Then.
Yeah. So going off what you just said, like you talked about the clenching. To me, my first thought is, why are they clenching in the first place? They're not just clenching out of nowhere. There's a reason we do everything. So how is their bite? How are their teeth hit? Because most likely they're clenching because maybe teeth aren't in a good spot. But not always. I have a patient I'm seeing right now who came to me because her dentist sent her to me. She has worn through all her guards. She's had all these issues with her dental appliances for years, 10 years. Dig into her history a little bit. Around the same time she started grinding her teeth, she got LASIK eye surgery. Within the same year, within the same 6 months. No, I'm not going to go deep into LASIK.
Yeah, it could be a trigger or stress, or could be a combination of both.
It's not stress. You don't clench your teeth just from stress. Stress is accumulation of life stressors, right? But now we go into it deeper. She's had her LASIK done over 4 times. That's very rare. And she had a visual discrepancy probably before LASIK where her eyes don't work well together, because even today she can't like sit close to the computer and work. She has to like close an eye. She's uncomfortable. She's going to see my optometrist. We're going to get it sorted out. But there's definitely more to it. Now, figuring out why is not always so simple. Every person's slightly different. But what you're saying is completely on point. And I will see eyes and teeth affect things like your feet all the time. And that's where people always think it's just the local areas. Definitely not. I see things, hip pain all the time. It's really interesting when you like dive into it. It's wild.
Okay,
So
yeah. Go ahead.
No, you go.
I'm probably going to move off of the direct topic for a second.
Sure.
But you're working with these other professionals as part of a multidiscipline team.
Yeah.
How do you come to do that effectively?
So typically the patient comes to see me first. So they come to see me. They've heard about me, word of mouth. Dentists sometimes send me people, and then a lot of people via Instagram and just word of mouth.
Okay, so why do other professionals send you someone?
Because they know that I'm the missing link. So let me explain to you the PRI techniques and why they work. So they come to see me, and I'm going to give them techniques that address the asymmetries. Most people will feel better with just techniques. The majority of my people do not see a dentist and an optometrist. I would say 25% of my people have to go to that higher level of integration. Majority of people need normal techniques. And the techniques involve breathing into balloons, straws, kazoos, very interesting torqued positions to allow for better airflow into places that are more compressed, and to expand in places that are compressed via airflow, and then to compress in places that are overly expanded or hyperinflated. So the techniques are really the magic sauce. So that's what I do first for a couple sessions with people. And then ultimately when I feel that using my testing that they're not improving at the rate I would like them to is when I would refer out. Not everybody sees my practitioners. Like I said, the majority of them don't. Vision's a little different because sometimes people are already wearing glasses, and so they might just need a prescription change. So sometimes I send them to other optometrists, their own, So, but I do work with 2 optometrists that see my more complex cases.
Okay, so if I'm an athlete, how do we determine that one or both of these things are affecting performance?
So I would start with my normal techniques, and typically people will feel changes and better first with my techniques. But those techniques, the changes that they're feeling, the improvement they're feeling does not hold. But they should already get some performance changes within just seeing me for 1 or 2 sessions. And then I'll know, yeah?
No, go ahead.
I'll know after a couple sessions if their body's not staying what we call neutral. So I have specific testing that we learn through Postural Restoration. It takes a couple years to get pretty proficient at them. Some of the tests are similar to what we learn as an athletic trainer. Ober's test. But I don't do Ober's test for the reason of an Ober's test. I'm not looking at a tight IT band.
Right.
I'm looking at, can the acetabulum, what position is the acetabulum in? What position is the femur in? Do we have a forward acetabulum? And when I try and bring the femur back and down into adduction, can I do that or not? Most likely, most people on the left side cannot do it. The majority of people can't. And if they cannot do it, then I know they cannot accomplish stance on that left leg. So a lot of it is looking at my basic testing every single time, pre and post interventions. If the intervention is trying something in their shoe, a different insert, a arch support, whatever I'm trying, sometimes I snap in their ear and show them something different. There's a lot of different interventions I can do, but the ones that tend to stick are the breathing techniques, neurosensory breathing techniques. So then I do that for a few sessions, and then if I am seeing that after week they're not coming in neutral, where the range of motion is similar side to side, symmetrical,
Right.
that's when I look at further integration.
Okay. So say we get to the need for
Yeah.
further integration. How do you manage that against like overdoing something?
Well, I just make them an appointment and we go from there. I don't know what you mean by overdoing something.
Okay, neither do I. When let me see if I can state that better. So when you're managing ailments for athletes, they have possibly an injury,
Sure.
and that's and you have these things going on and this injury. How do you manage
Well, this is
that?
the how I treat the injury. They're not
Okay,
two
that's
separate things. So it's
all
like
right.
one
That's
thing,
what I'm
right?
talking
So
about.
let's
Yeah.
say, yeah. So it's all one thing. So whatever their reason is for their main complaint, if it's knee pain or back pain, they also have neck tension. That's what I'm aiming at. I'm not just doing this stuff just to do it. There's always like, I'm always going back to their main complaint. Is that getting
Okay.
better or not?
There we go.
Does that make sense?
Yeah, that makes
Okay.
perfect sense because I believe our audience, when you talk to coaches and you talk to athletes, and you know this as well as anybody we've had on the show, when you talk to them about injuries, getting to the bottom line, sometimes we understand all the steps and all the reasons we're doing something. They don't.
Yeah, I just want to figure out why the injury is happening in the first place, the root cause of it. I don't want to just patch someone up and push them back on the field. Why is somebody tearing their left ACL? Why do we see so many left ACL tears compared to right? There's a reason.
Okay, so let's you're
So that's a
walking.
can of worms.
Well, I'm gonna we're gonna go there. Why are ACL injuries still such an issue, specifically for female athletes?
Well, it's a
Because
mechanical position too. That we know
yeah, but it was a mechanical position back in 2005.
They're
for sure.
competing on turf. They're competing more. They're
Yeah,
spending more time doing the same stuff
there's a
and
lot.
less time training. They're not focused on develop muscular strength. They're focused on developing muscular endurance, which doesn't give them stability on the turf to be able to manage the impacts you're dealing with on a regular basis. Pound for pound, just as strong in the lower body as men are. Pound for pound. Composition of muscle tissue might be a bit different in terms of type 1 versus type 2 explosivity fibers. If you're training for explosivity, you're going to develop those X fibers into more B type fibers. If you're not doing that because you're fearful of gaining fatigue or creating a situation where maybe a woman is comfortable with it, right? Whereas a man would be totally comfortable, no problem ever. Your coach uncomfortable with having your athletes jump or laterally back, right? Because we don't bet on the field. Okay, fair enough, but if there's a thing link there when you put them on the field and they may have to do that maneuver or that action, you better hope that it's not repetitive, because acceleration deceleration piece is going to lead to, doesn't matter what the sex is, it's going to lead to a problem.
I agree.
Now from the trainer standpoint, it could be a little different, right?
Okay, yeah, I'm asking the question is because I had the same question. This is a generational question with athletes because it started in let's say 2000 when it was brought up. Why the ACL tears? You didn't see a lot in men, but you did in women. Then we
I
started
think
going
you're
to,
always going to see more in women with that.
but
We have
then
hips.
yeah, right. You have hips, you have acute angle. That's all that
We have
stuff.
ligament laxity compared
Ligament
to men.
laxity,
They're always going to see it.
right? But why are the numbers going up, not down?
I do not think that coaches know what they're doing when it comes to proper recovery. I think it's better now, but I don't think sitting in a cold tub is recovery. I think
No.
understanding how to get into your parasympathetic nervous system is true recovery. And you can't get there if you are not in stance on one side and swing on the other. If you're in stance on both sides with the pelvis forward on both sides, say goodbye to your ACLs.
Yeah.
And I do not think that coaches are that educated in it because they're educated in their sport.
And yeah, and it's. I was just getting ready to go to that. A lot of
You
things
know?
coaches, you can't blame them.
No, I don't.
There's no blame to be handed out except for the fact that somewhere within their education they need to be made aware of these types of differences or these types of things going on, and they're just not.
What it
Well,
comes
I
down
also
to,
think
I
it's
think, is
yeah.
not it's happening more frequently. Is that women's sports are more popular now, and
Yeah,
they're
yeah.
gaining
True, true.
notoriety, and we're hearing more about it because
I
there are more women athletes in the NCAA. There are more professional women athletes out now.
that's a great point. And I don't know the answer as if women have specifically more the numbers based on, is it 10% for women and 5% for men?
There's just a higher propensity for the injury to happen based on
Yeah,
the things that Aleena said.
Well, I'm looking at right versus left. I don't
Yeah.
care if it's a woman or man. Really, I
yeah,
mean, I definitely think that there's differences, biological differences there that
right.
would make a woman tear theirs more. Um, the same way that it's harder for a man as they get older to expand their palate, you know,
Yeah.
way
Talk
stronger.
about that. What's that
It's
about?
interesting. After the age of around 15, it gets very hard to like physiologically, biomechanically do a palatal expansion. You have the suture, and to open it up is very difficult, much harder for a man because you guys, men are stronger and their bones are made stronger and their muscles are stronger and tougher. And I think orthodontists will tell you that. They'll tell you that it's harder to break that palate apart on
So
an 18-year-old man versus an 18-year-old woman.
here's the next question off of um, the ACL question. Are we seeing more Achilles tendon tears in field and court sports in the athletes? And if so, why? Are we seeing more?
I don't know. I'm not really working with like that many to know.
Right.
I see these athletes 10 years after they're done and they've retired and they're in chronic pain. That's my population more. Although if an athlete came to me in their prime, I could help them too. But I don't know enough about that specific topic to really comment on it.
I think it's there. I just, again, I think it's not that happen more frequently, right? Those types of injuries are signs before that injury happens. There are plenty of signs that go either misdiagnosed or they go completely unidentified by coaches, by strength coaches, right? In movement analysis, we're not doing enough of that in the process of trying to gain more mobility or more stability out of these athletes. So, I had a friend that tore his Achilles. And there were a lot of signs that he was going to tear his Achilles before it happened. We didn't really observe it to the point to say we should get looked at until unfortunately it separated. But the writing was on the wall based on his ability or his inability actually to squat. Was a pretty good sign that there was something going on between anterior and posterior tension through that mechanism. Now I think we're becoming much like ACLs and turf. We're becoming more aware of it because we're trying to, I think, as a field in a whole, we're trying to prevent these problems, right? Even though we know there's real injury prevention, right? We try to make athletes more resilient to them by giving them the abilities, by adapting their physiology, by adapting their biomechanics, by adjusting their bite, right? You hope maybe that doesn't affect their feet as much as it might have, right? But if you're not thinking along those lines, I think we're just becoming more aware of maybe what we can do as a field to try to enhance performance, to try create a process of performance for a longer period of time, right? So athletes continue to get successfully without having problems. So I think it's setting us to reaching a little bit more, maybe a little bit more field soul searching, right? Where we're looking at these injuries and really trying to not just treat them, trying to figure out where, like I said, where did it come from? Where did it really start? Let's find the root cause, because that root's probably going to cover another root, right? You dig a tree up and you have all the roots out, and then you find another one, and that one's even bigger than the last one. So now you got to get that root grinder out, right?
I agree. Yeah, the root cause is really important.
And finally, we're not even close to the end of the podcast, but on my questions on these subjects, let's discuss the return to activity, return to play, return to competition continuum. As an athletic trainer, I know you've seen this whole process play out. Here's my question. Does it feel like to you that sometimes we skip over some steps that we need to take?
Well, if you're not doing PRI, in my opinion, you're skipping everything.
Okay.
I'm very biased to what I do because I see it works every single day. And people come to me with these like crazy stories, and nothing gets them better, and then we can make some changes. But I will say with return to play, if they are not able to accomplish right stance and left stance equally, they shouldn't be returned to play. And the problem is we don't learn in traditional schooling how to do that. We talk about stance, we talk about swing, we talk about the gait cycle, but we do not learn anything in the rehab realm that touches even on the iceberg level of the postural restoration. So when I, let people, they're done with treatment with me, they're hitting good numbers on certain tests that PRI has brilliantly put together. And I know that I'm sending them off into success.
So for
when
me,
I was in athletic training, like in graduate school, I had no idea. How would you know if someone's ready to go back to play? You don't really know. How do you feel today? Your symptoms feel better. That's not good enough.
There's 3 steps to me. Yeah, there's three levels in my brain. There's return to activity, return to sport, and then return to competition.
100%.
Because you can go do sports related things, but still not be ready to go out and compete.
And it also depends on your sport. I was an Olympic weightlifter. I'm never, as an Olympic weightlifter, going to accomplish right stance and left stance in my body properly and hold it, because I am in a bilateral extended position with the sport I'm doing. Impossible. So it depends on your sport. Same with gymnastics. You're not going to get that. They're symmetrical bilateral sports. Baseball, on the other hand, very different. Could definitely get that with a baseball player, and it'll make them really successful.
Okay, so
some might argue that certain asymmetries, like in a sport like baseball, right, are an advantage in ways.
Sure.
So how do you?
Until it's not, because it's causing injury.
Right, but let's say that it's actually causing the injury. How do you determine from your professional experience in what you're doing with PRI? How do you determine, do I mess with this or do I not mess with this?
I always mess with it.
Do you wait until there's an injury, or do you try to tweak it a little bit and see what kind of result you get and maybe back, like play around with it to very small degrees and see if you can manipulate them in a way that's beneficial?
So let's say you have a baseball player, righty baseball player, okay? Very good at their sport. Unless they're in pain, why would you mess with them? Sure. They're not going to come to me unless they're in pain. That's first of all. So I'm not necessarily seeing somebody unless they're having problems. What baseball player do you know that doesn't have little aches and pains? They all have something, right? Yeah. So whatever, they come to see me. I look at them. I give them breathing stuff to do. I notice that they're so dominant over their right side. So what I'm going to see is a lack of right internal rotation on the right side and a lack of left hip IR. Now, they're baseball players. They could have stretched their shoulders like crazy, and they could have IR that goes all the way down. That's worse. I don't want to see that on a baseball player. That tells me that they've pathologically stretched down when they have no way to expand this right chest wall. So, and left hip IR, let's say. Left hip IR will be limited because the pelvis on the left side is forward, putting the femur in a faulty position to not have adequate hip internal rotation. So let's say you have those two things. Let's just go off that. As a baseball player, you're going to have excessive ER. You have to be able to still get into the internal range of motion position. And then you're finishing over on your left leg. You have to be able to get your pelvis on the left side back and finish into IR on that left. So they're going to have an extreme asymmetry because one, they're human, two, they're playing a sport to a high degree, but they still need full range of motion both ways. So if they came to me, whether they came just for optimization and they felt good, or they came to me for an actual injury, I would still treat the asymmetry. And you're not going to hurt somebody by giving them more of what they're lacking. But you can't stretch them there. That's where I see coaches not know what they're doing. It's not their fault. But the stretching, all the shoulder stretching, I think is creating large pathology and long-term creating more issues for these guys.
You're actually
Say that again.
Strength there.
But
Yeah, say that last statement again.
I think that the overstretching, the bands work with the shoulder stretches that they're doing. Tennis does it. Baseball does it. I think it's creating much more pathology for these athletes than they even know.
Okay.
And that's coming from someone who was a gymnast. So understand my background. I stretched as a kid. I was in 10 times more pain as a 15-year-old gymnast than I am today. There's a reason for that. I have much more tension controlled in my body now, but I'm not really in a pattern the way that I was as a gymnast.
Okay.
Yeah.
Sometimes too much range of motion is a good thing.
Yeah.
I think almost
Ideal.
always. I don't like to be like absolute with my sayings because of course like everybody's different, but when it comes to hypermobility and stretching, I'm pretty absolute because it's clear cut to me.
Yeah, especially if you're doing something dynamic.
Yeah, you just don't want excessive range because the more excessive range you have, the more your brain's inability to control your body's movements. It could be detrimental. That's why people with EDS are in so much pain. Not their fault, but their brain's nervous system is on fire. And it's not just an EDS diagnosis. They have a lot more. Never EDS by itself. It's EDS, it's hypermobility syndrome, it's POTS, it's dysautonomia, it's a bunch of things.
So
Those are hard patients.
Tell us, as we continue to matriculate on through this podcast,
Yeah.
tell us why you got into this profession. Not how. You told us how earlier. Tell us why.
Well, I always knew I wanted to work in the field. I really wanted to work with gymnasts, mainly to be around gymnastics. I loved the sport, but it didn't feel right when I was in grad school. And then I became an athlete, and I was struggling myself. But PRI helped me, of course. Like, I had classes since I'm 15. Things made sense with PRI as to my story. But I started to understand holistic health in general, and I went a more holistic route for my own healing. So, for example, myself, my story is basically that I was a very high-level athlete. I was trying to go to nationals for Olympic weightlifting. It was 2019? 19? Or 19. And it was, I had qualified, but I had to cut weight. It's a weight class sport. So I weighed like 116 pounds. I was trying to go down to the 105 class.
Yeah.
And I was lifting a lot of weight. I was really small. And my hormones took a major toll. Mm-hmm. I couldn't handle it. My hormones had probably not been working properly since I was in my 20s. I was probably 24 at the time, 25. And I completely crashed. I was in perimenopause at like 25 years old. People don't talk about this. People don't talk about how hard athletes work and how much of a strain is.
What do you attribute that to within your gymnastic style? Like, what do you think was the trigger?
So I stopped gymnastics like 4 years before. So I don't think it was necessarily gymnastics.
Yeah, you don't.
But you don't eat that much growing up when you're a gymnast. And so when you don't,
That's the
yeah,
lifestyle and the nutrition.
right.
You know,
And
you
I didn't know how to eat properly until
right.
I did, and I also did a bodybuilding show. So I always was in weight class sports that played with your food.
Mhm.
Yeah,
But
you were
the
always
more
in
I
caloric
learned,
deficit.
yes, but not when I did bodybuilding. I was eating over 2,000 calories for over 8 months. I felt amazing. So,
Of
but
course you did.
I felt
and then
amazing.
and then you
2,500 calories.
crash
And then I
diet.
cut it all
Then
down.
yeah,
Yeah,
exactly.
She said I ate 2,000 calories or 4,000 calories. That was
100%.
fantastic.
No, no 4,000 calories in my week. Um, I think that is a big thing for sure. The food is a big thing. I also lived in New York City. People don't understand what that's like to live with a train outside your window where your apartment vibrates every time you have 4 trains passing. But that
You
will
get
really
used to
eat
it.
your nervous system. You don't get used to it. Your brain will never get used to that
That's what
stimulus.
everybody says, though.
That's what they say.
Yeah,
They
you
told
get
me
used
that
to it.
too. They told me that too when I moved in. The lie. I had chronic insomnia for 4 years. Had a lot of symptoms that perimenopausal women get: night sweats, horrible PMS for like 2, 3 weeks of the month, 2 weeks usually, to the point
That
where
don't even
I
sound
was
fun.
I was very depressed, and I wasn't myself.
Mhm.
And that's the things that I see with people all the time now. They're struggling with this. Now, the more I've learned about myself, I have a couple gene mutations, which some of the population has, makes it very hard to break down certain B vitamins. I have more ability to have anxiety, depression type stuff. There's different things you could do, supplements you could take to support those genes. I was born like that. Um, that doesn't necessarily mean they're on, but my body was in such a stressed out state that I know those genes were like,
Did you
on.
know that from birth? It's something that you kind of come to find
No,
out
it's
with with a
mm,
split.
no, no. It's called MTHFR. 40% of the population has it. There's another one called COMT, and I have a genetic mutation in detoxing estrogen. And so when you can't detox
Ah,
estrogen well, and I know
yeah.
this because my mom has had issues, and I saw her story when I was 18. I started getting my own thyroid tested because I watched my mom and her thyroid and her story. And my thyroid has been low since I'm 18. So I know that my stuff started when I was young,
Mm-hmm.
but I also think there's a big genetic thing for it for me. But there's a gene SNP that doesn't allow you to detox estrogen. So when you have that, you're more likely to struggle with these things I'm talking about. But a lot of people have this. This is not rare. So that's the thing. I was struggling with my own sport, and I also just needed to get out of New York. So when I left New York, a lot of my stuff got better. I needed to leave. Then I did PRI, did dental and vision integration for myself. I was actually in the wrong prescription for 4 years. I was overcorrected by a full diopter on both eyes. So that's a lot.
Wow.
And
Yeah.
that's pretty common.
Really.
Yeah, half a diopter is common. A full diopter is not as common. Being overcorrected is common. But I was overcorrected. And as soon as we changed my correction, the stress in my body decreased. I started to sleep that week.
Hmm.
So there's a lot of contributing factors. The only reason I know this is because I dove deep into everything health wise. I learned about so many holistic things. I stopped burning candles. I used to burn candles like crazy. Candles let off estrogen. There's xenoestrogen. I can't detox estrogen. I just got a rental car. There's a little car thing, a car freshener. I took it, I threw it in the trash. I can't be near that. I'm
Mm-hmm.
sensitive to perfumes. I'm sensitive to smells like that because I can't detox estrogen well. So these are like personal details, right? But I'm fine with being vulnerable. I think that people listening should know that these things are out there and can make it harder. But I learned this about myself, and it made me like want to learn everything about health as much as I could. So I did.
So I
Make
think
it they make it
people.
a really big deal for men, right? With the cans and the
Yeah,
phytoestrogens and all that stuff, but they don't talk about it in women.
they
Not
talk about
talking
it in
about
men.
genetic
Yeah.
code script that you have that's a little bit
Yeah,
morphed that makes
yeah,
you just as susceptible, if not maybe even more susceptible than we are. But they're not talking about it. They're
no,
saying, don't burn
no.
candles because it's going to make you estrogen. But probability of becoming hyperestrogen as a male pretty low.
I
Probably
do think
not
that
from a
the sperm population, like the testosterone, is really decreasing for men.
Yeah,
Like
yeah.
so many, and I think it's because of that stuff. And air
Yeah, I
and
would agree
water.
with you. Yeah.
100% air and water, a big factor.
Bottled water leading phytoestrogens.
Oh yeah, I mean
Everybody
bottles
drinks
with the
water.
plastics. Yeah.
Right.
So it's hard because our society is pretty toxic. And once you're aware of it, then you know, and you're like, what is going on? And then it just opens your mind to like other ways of healing.
It can drive
So-
you nuts though too. Like when
It
you
will
looking at all
definitely.
this stuff, it does
So
drive you
do it.
nuts.
It's so much.
It's really overwhelming. And then it's like, what do you do? Like, I still get my blood work back, and it's like, okay, yeah, I feel better, but it's not better the way I want it to be. And it gets very frustrating because it's like, what do you do?
Yeah,
It's like,
when you
okay,
think
I
you're doing
feel
the right
better.
things.
Then you get old.
Yeah. Yeah. Or like for me, it was always such a struggle to lose weight. Like I remember my friends would like try nothing. My best friend eats horribly. I'm like so healthy. I can't lose a pound for life. And I know there's like a genetic component, but it's like it'll drive you crazy. But I'm not going to starve myself.
Yeah.
No,
Nothing to do
that's never the
No, but
answer.
athletes think it is because they
Yeah.
don't know.
Oh, and I watch them. I watch them
Hard.
not eat on purpose because they want to drop 5 pounds.
I know.
You know, and then they wonder why the next few days of practice have been horrible.
You know,
Well,
it's funny.
They don't know the damage that becoming hyponatremic is. They don't know the damage that becoming dehydrated causes. They just, oh, I'm dehydrated, so my mouth is probably going to get dry. But they're not being told that it has on macronutrients in the body. Not being told that it has on plasma in the body and how that affects our blood and what's in our blood and how we evacuate things and how we get rid of carbon even. Right?
Yeah.
I agree.
Just missing so much information, and it's a lot, and not people want to know about that, except for the likes of us. But it is far more damaging than we lead people to believe because we think that they don't want to hear us talk for an hour about a specific topic. But chronically being dehydrated is very, very damaging.
I agree.
So
I
now-
think kids don't think about it.
No,
I didn't think about this when I was younger.
No.
I
I didn't care. I just wanted to do my sport.
Right.
And actually, you know, I'm not so certain that athletes at the lower levels need to think about it, but there needs to be a place where they learn about it, so that as
they need to think about it at the lower level. They need to think about it when they're small. They need to have these things in them when they're small because that's what sets the precedent for how they act as an adult. It's essential that these kids get this education. I'm talking like 6 bachelor level courses. I'm talking they need to understand why they need to eat certain things, why they need to hydrate a certain way. Very important to set that boundary of what I should avoid and what I should understanding. I had several nutritionists on. Understanding there's malleability there. Doesn't mean that you have to be flexible. Diet is the best diet, right? But a flexible diet can be over flexible if we're not educated on what the
Okay, now you're hitting on what I'm talking about.
It's hard.
Okay, but I
agree.
got you. Yes, they need to be taught about it. They need to hear it. They need to understand it. But somehow we can't make it punishment. And
no, it shouldn't be punishment, but it is the crux of performance.
Right.
I don't know how good you are. If you don't eat and hydrate and give yourself electrolytes,
and that's the
you
bottom
will
line.
not perform to your absolute optimum.
So there's nutrition and rest
I agree.
that are part of the 3 legs of the stool. Preparation is the other part. But go ahead.
And then mental fortitude is the third. It's not physical. But I do agree with you. I think you do have to be a little OCD about your diet when you're an athlete. And I think that there's a level of that that's okay. But you do have to learn when you're done being an athlete to be okay.
At what level do you need to start being OCD?
You're asking me. I was a bodybuilder
I know.
and an Olympic weightlifter. I was
Yep.
very OCD with my food. So
but
I don't think what I did was healthy. Actually,
but
I
you
know what I did wasn't healthy.
and you probably when you were a gymnast, probably what age 10 starting.
I actually have a different. I started later. I did recreational gymnastics. I just always picked up sports really well, so I actually started more competitive at 15. So it's a little different.
Yeah, but that's when what you were eating became important.
Yeah,
You know that's the point I'm trying to make. There is
for
if
sure.
it's how much do you need to know and how soon and how hard. I think nutrition should be a focus if you're going to be a painter on a ladder.
Well, I think these
But we're
gymnasts.
talking about
Yeah.
athletes.
Yeah, I think these
So
gymnasts now are getting a lot of really good education in the gyms, like privately owned gyms pull in nutritionists and talk to them. And I think that's really important. So I'm a big fan of that. I'm a big fan of working with nutritionists. I have a few I work with and send people to, and functional medicine doctors. I can't help my people without those professions.
okay, how many strength trainers you work with?
I don't. That's not true. I refer people to strength trainers in Manhattan that do like one-on-one training. Um, so I have one I really love and trust, and his schedule is getting kind of full. And then I have two females that I really like too. So a couple.
Okay, see, because Chris and I, by profession, are strength trainers,
Yeah.
We're strengthening coaches. I hate that
coaches, trainers. Okay, so however you want to say it, strength coaches. Okay,
Yeah.
he hates
Your word, practitioner. I like
practitioner.
that even better.
I like that word.
My word is practitioner.
Yeah,
It's a good word.
I find that everybody else we talk to, they say trainer. Chris's
Yeah.
word is coaches.
I don't like the word trainer either because I, as an athletic trainer,
Messes it up.
and I'm a
It's
personal
messy.
trainer too, it's confusing.
Yeah.
It's really muddy. So, but we like to hear when other people in the professions of performance refer to us because we refer to everybody.
So I'm in New York City, so it's like hard because there's not really like strength and conditioning coaches. There's personal training. You know what I mean?
Really?
There aren't
There aren't strength coaches in New York
like
City?
Pat Davidson. There is, but it's not the same as how you like. There's no like team gyms where like you know what I. There's like this cool camaraderie. There's like Soul Cycle. You know,
Yeah, that's a fitness gyms.
there's like fitness, group fitness. People love their group fitness in New York
Yeah.
City. Well, and I lived in Texas. I know what strength and conditioning is about.
Right.
Where there's like group fitness that's like, I don't know, it's different.
Yeah.
You don't have the room in New York City to have turf like that.
Right.
And like, I
You
wish.
got $1 billion, then you're okay.
Rooftop.
They do have a couple of really good spots. Like there's a gym in Chelsea, and that's who I typically refer my clients go to this one trainer, strength and conditioning coach that is there.
I have found though that there's a lot of what you're talking about, and especially in more built up areas, there's a lot of Pilates centers and fitness organizations and anytime fitness and everyday fitness, which are all okay and great for what they're for.
Yeah.
But if you say find me a strength conditioning coach,
Hard to find.
or you know a movement specialist or anything like that, you start breaking it down. There's a lot of folks out there that say they do those things,
I agree.
but then when you start looking at their credentials and their backgrounds, you find out not what I'm looking for. Not useless. They have usefulness. So anybody out there doing that, I don't want them to think that just because you're a Pilates instructor that you don't have any usefulness, because you do. That's what you chose to do. But you can't claim strength and conditioning practitioner. You
I
can't
agree.
you can't claim athletic trainer. You can't claim, postural assessment and all those other things. So it's a matter of educating the public, I guess.
I agree.
So You want to ask your last question there, Chris?
We can do that. So if you had to pick one athlete, okay, and this is an athletic position, not an actual human with a human name, an athletic position in a sport. Now, this athletic position in this sport that you're choosing, this particular act, this particular position, could probably do well almost any other sport that you think of. They wouldn't be the
Okay.
best. They definitely would not be the worst. They could go out and compete at a high level. Who would that be?
I have to pick an athlete that could do any sport, pretty much.
Pretty much.
Simone Biles, easy.
Yeah, but
not a name.
not a person.
Wait.
Not an actual person.
Oh, a
not
sport,
a human.
gymnastics.
A gymnast, you're saying?
A gymnast, yeah. I think
Okay.
gymnasts, as much as I think gymnasts are amazing, amazing athletes, because there's a fear aspect that they have to get over. Then there's this mental fortitude of being able to do what you need to do in competition time, which every athlete has to do.
Yeah.
And I mean, old school gymnastics, you're typically operating on a lot of stress and being screamed at, which a lot of sports are like that. But I've seen a lot of gymnasts transition to like Olympic weightlifting and other sports, and they're fantastic. Now, structure wise, they can't do as well maybe as some other athletes because we're short. But explosivity, just the way that they're built, I think the conditioning that goes into being a gymnast. Like, look at a male gymnast.
Their hand-eye coordination is
because you
more
look
than
at
adequate to hit, catch a ball, field, do all those things.
Not to catch a ball necessarily, but if you look at a gymnast,
She said, "Okay, not catch a ball."
we're not that great at. It's not a ball sport.
Yeah, but
I think
you can.
you have to still know.
I'll butcher what you
have
have
to
to.
spot.
You might on the pole when you're swinging, right? You have to come off of that pole and orient yourself, and then catch it again.
Yeah,
I think the skill is there to do that.
Yeah,
that object isn't coming at you. You're
the technique,
the
technique's not there because you don't practice that. The
well,
skill
you have
there
an
is,
object coming at you. That's different than you coming at an object.
I agree.
Right.
But they also do run at a vault.
Yeah.
But I mean, I definitely think there's this cat-like ability to like land on your feet.
Mm-hmm.
And that's like an internal gyro. What is it? A gyroscope?
Yeah.
Yeah.
That cats kind of have. And I think that's vision more than something coming at you and catching it.
Yeah, I agree 100%. That.
I think, I don't know, I'm biased. I love gymnasts.
So we have gymnast.
I think is that the first gymnast that we have, or do we have somebody say like an Olympian, or that could be anything?
Yeah.
I feel like somebody say something that's along the lines of gymnastics at some point.
I really love the sport. I
think we had somebody talk about it, but then picked something else.
Maybe we've had a lot of fall, lots of.
That's awesome. I love it.
All right, so listen, glad you were able to join us today. Glad you showed up. It was
fun.
Great to have you on, and flexibility, outstanding. You shifted from a part of a panel to being the only guest, and we appreciate that.
Oh, I'm cool. I'm going with the flow.
So, look,
I enjoyed it.
We like to say we're going to invite you back, and we likely will. For one reason or another, if we ever get this panel thing right, we will definitely. But we can do. I can't even tell you what that's all about, so we're just going to let it be right there. But Chris, you got anything?
For having me.
Anything else?
You're very welcome for everything. Thank you for joining us. This has been Performance Talk with you, Chris Costa. Today's guest, Aleena Canner.
Yep, Canner. You're right.
Canner. We'll see you again real soon.
Thanks so much.
We're out in